Howdy folks! Wow, another week. This week, I'm going to go over what hospital medicine is, or what I do as a hospitalist. Now, some of you might be surprised, although hospital medicine, or being a hospitalist, might be something familiar to some of our fellow citizens and friends in America. A hospitalist physician does not exist in every country. In fact, probably does not exist in some of our most familiar countries. Anyway, regardless of whether you are familiar with hospital medicine or not, I will go over this profession extensively over this and I don't know how many more future clips, but I will cover this profession. The goal of this particular series is to help folks understand what hospitalists do, my perspectives on being a hospitalist, what I like or what I don't like about being a hospitalist, what you should know about hospitalists as one of us hospitalists will very likely be taking care of either you or one of your family members or friends sometimes in the future or sometimes in your lifetime. And finally, hospital medicine as a potential career option for medical students, residents, and folks in healthcare. So, let's go! Howdy folks, this is Dr. Bao. Yeah! The goal of this channel is to make it useful for those of you who might be interested in learning more about a doctor's life. You could be a student, a resident, a fellow, an attending, a parent, or someone who simply loves to information overload yourself.
Seriously.
Although I do work and am affiliated with some hospitals and med school, what I say does not represent the opinion of any entity except myself. Please like or dislike, hopefully not dislike, subscribe, comment, share, and press that bell icon.
Great.
All right, so first, let's go over the definition of hospital medicine. And we will use the definition from the Society of Hospital Medicine because I think this definition is number one, solid, and number two, I just don't think you can get any significantly better definition than this one. So here we go. Now, the definition is a bit long, but I will break it down for you all. Hospital medicine is a medical specialty dedicated to the delivery of comprehensive medical care to hospitalized patients. Here, I want to emphasize hospitalized patients because hospital medicine focuses on hospitalized patients, meaning those patients who are hospitalized. Yes, those patients who are hospitalized. I mean, duh. You know, I sometimes wonder. But anyways, so for those patients who are hospitalized, meaning they are in the hospital, as opposed to those patients who are at home, at a rehab place, at a skilled nursing facility, or a long-term acute care facility, at an urgent care clinic, at a primary care physician's office, or at other places. Practitioners of hospital medicine include physicians or hospitalists and non-physician clinicians who engage in clinical care, teaching, research, and or leadership in the field of general hospital medicine. Now, as many of you know, I am a hospitalist, or at least that's one of my jobs. And I like it, or I should say, I love it, at least in general. Why I like it or love it, we will cover later. But for now, let's go back to the Society of Hospital Medicine page and finish that for everlasting paragraph. Hospitalists manage and treat a significant range of complex and comorbid disease conditions. This one, generally speaking, you do not have to know the details, meaning what kind of conditions hospitalists treat. That's us, that's our job. So you don't need to know the details, but just know that when you or someone you care about gets admitted to the hospital, there is a very good chance that you, he, or she is being taken care by one of us, meaning the hospitalists. Hospitalists typically undergo residency training in general internal medicine, general pediatrics, or family practice. Most of the hospitalists I know are trained in internal medicine, such as myself. And I also know some hospitalists who are trained in family medicine. In fact, a few great friends of mine are indeed hospitalists who got trained in family medicine. Now, I obviously also know hospitalists who are trained in pediatrics, as I was also trained in pediatrics. However, it is probably worth noting over here that all physicians who finish pediatrics residency in 2020 or later must complete a fellowship in pediatric hospital medicine to become board certified in this particular specialty, meaning pediatric hospital medicine. A minority of hospitalists specialize in fields including neurology, obstetrics and gynecology, and oncology. I also happen to know hospitalists who specialize in adult infectious disease, adult endocrinology, adult nephrology, and pediatric hematology oncology, such as myself. Why? Why, you might ask? Well, everyone's reason might be a little bit different, but I'll give mine, as well as some good guesses for others in the future. So, how did the term hospitalist come about? It turns out that this term likely originated sometimes in the mid-1990s. Before then, what happened often was that primary care physicians would round on his or her patients who were hospitalized, meaning a primary care physician has his or her patients in the clinic. And when one of them, or a few of them, or many of them get hospitalized, he or she, instead of seeing them in his or her primary care clinic, these primary doctors will go to the hospital and see their patients in the hospital, acting as the hospitalist. However, as time went on, a lot of factors came in, but long story short, the need for a dedicated hospital medicine system within the American healthcare system increased, and the field of hospital medicine has really grown exponentially over the past 20 years or so. As a hospitalist, my job is shift work, meaning I work in the hospital, say from 7A to 7P, or 7P to 7A, or 1P to 11P, or 5P to 2A, or something along these lines. You get the picture. When I'm in the hospital or on shift, I take care of any patient care needs for patients who are either on the hospital medicine service or who need immediate attention in the hospital. This is key because not everyone in the hospital is primarily under the hospital medicine service. For example, if someone is generally healthy and is being admitted to the hospital for, say, an elective hip surgery, the hospital medicine service might not get involved at all. In this particular case, generally speaking, this patient would be admitted under orthopedic surgery service. And so while in the hospital for this particular patient, for any non-urgent or non-emergent needs, the nurse taking care of this patient will get in touch with the patient's primary service attending physician, ortho in this case. However, if for whatever reason this patient crashes and needs immediate medical attention, I might get involved, especially if a hospital code is called. What does this mean? This means you should be nice to us hospitalists, because there is always a chance we might be involved in your medical care, especially when you are sick. This means hospitalists are very special people and care for those who are particularly medically vulnerable during whatever stage or stages of their lives. We understand being admitted or being in the hospital is stressful, and we will do our very best to make you feel better during your hospital stay and discharge you home as soon as it is safe. Back to our schedule. So, while we're in the hospital or on shift, we take care of whatever we need to take care of, including possibly being a consultant for other services like ortho, emergency medicine, and other surgical specialties, and perhaps other services. Now, when we are off the clock, we are off the clock, meaning we are off the clock. Meaning we're not answering patient emails or dealing with things related to our on-shift work. Though sometimes we do have to respond to certain queries and emails within a certain time frame after our shift is over. But generally speaking, when we are off the clock, we get to use our time pretty freely. The general schedule as a hospitalist, we have a schedule called 7 on, 7 off, meaning we work for 7 days straight and we're off for 7 days straight. 7. By the way, this is how we do 7 in Taiwan, not 7. I think 7, you just need to use one hand. American folks, man, sometimes I don't understand. You guys use so many things for, things get complicated in America sometimes, But anyway, that's not the focus of this clip. Moving on. The schedule at certain places might not be 7 on, 7 off. There are places where the schedule is like 5 on, 5 off, 11 on, 11 off, or some kind of combination. You get the point. During your off time, again, you do you. As hospitalists, we don't have clinics. So other than some minor emails and queries that we have to respond from time to time, when we are out of the hospital, we are generally free to do whatever we want. On our free time, most of us, myself included, either spend time with family or we might choose to work more, depending on our different personalities. And because it is shift work, I want to note that the more you work, generally the more you make, which also means when we don't work, we generally don't get paid. So How much do we make as hospitalists? As we discussed before, physician salaries depend on a lot of things, one of which being location, just like real estate. And speaking of real estate, if you are ever interested in real estate in Tennessee or around Nashville, you should get in touch with Mushi, the best realtor on earth, in my humble opinion, as I've got no choice of saying otherwise, because that's what marriage is about. All right. Here's the map. As we can see, hospitalists in different states make different salaries, but generally speaking, anywhere between $200,000 to $250,000 a year. Why most in North Dakota and least in Massachusetts? I have no clue, but I feel like I'm getting underpaid. So that's it for now. I'm gonna go make some more money so my family can hopefully have a better life. Next clip, I will give you my personal perspectives on being a hospitalist, such as the pros and cons, is it worth it, blah, 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 blah. If you have questions about medicine or being a doctor, leave a comment and I will get back to you. For now, best of luck.